I was hoping to have one or two original thoughts, but alas, it's not true. So please bear with me as I duplicate what everyone else has said. It's just a few minutes. So I'll talk a little bit about what we do at the University of Maryland to prepare the residents for FES. So I think it's important to take a stepwise approach. And at least one thing that nobody else has talked about is you have to assess your institutional awareness. I think it's true, at least in my place, that there are many surgeons and perhaps even some of the leadership who aren't aware that FES is coming and the residents have to take it soon. You have to determine your resources. Some people may only rely on clinical experience for training. Others may have a nice simulation lab. Others may have something in between. So you have to assess what you have that's useful for training. You have to introduce the topics to the residents. They often have a blank look on their face when I first talk about FES and FEC to them. And then you need a graduated training program over several years' time in order to become a competent and then a proficient endoscopist. So it's important to emphasize the requirement for training. In order for them to sit for their boards in surgery, they should pass the FES examination. And there are many resources available online especially, so I emphasize that to them, that they should be using those and doing that all along rather than on the day before the examination. So here's what we have in Baltimore. It's nothing fancy, an old endoscopy cart stuck up in the Mastery Center and our simulation center. So the first thing I do when I bring the residents up to the lab is just go over the anatomy of the cart and the scope, how all the wheels work, where the suction channel is, how to put together the scope, what the video processor is. And then the next lesson would be troubleshooting. What if the buttons don't work? What if you're not able to wash the lens? Those kinds of things. These are very useful in the first year of residency, and then it's important to reiterate that as during their endoscopy rotation. What I've been using for a couple of years now for endoscopy training is something developed by Matt Ritter, who's the last speaker here. The new name of it is the ETS endoscopy training system. And what it is, it's an inanimate training box that we can use to somewhat replicate the tasks on FES. Dr. Ritter will show a lot of nice data that indicates that it's probably a very useful training platform. But what we hope to replicate is some of the scope manipulation, the mucosal inspection skills, retroflexion, et cetera, that will be tested on FES, and in turn are useful during their clinical rotations. All along the way, the residents are doing their rotation, they're scoping in the operating room, they're doing some simulation on an intermittent basis, so we can reiterate these points, build on what they're learning in the clinic, and then hope to hone some of those skills. While they scope with me, I try to use that as an opportunity to review some of the didactic topics that they should be learning about. Many of them haven't, so it's a good time to indicate what they need to focus on during their reading. Some of these that you see here are not often, they don't pay much attention to them usually, but they come up on the FES examination. So, patient preparation, how to sedate somebody properly, pathology recognition, we often talk about that. They might not see lipomas very often, might not know what an AVM looks like. These are important things to emphasize. Complications again in some of the more advanced techniques. So there's an important question which many of the other speakers have talked about, is when to take FES. I think taking FES during the PGY 4 and 5 years is way too late. It's better suited for PGY 2 and 3 because we know the F, that's fundamentals. This doesn't indicate that one is proficient, competent, anything. Just give some basic skills to perform endoscopy. So if we have time, I like to review some of these credentialing documents, which the others have mentioned as well. This is the SAGES document, and then the ASGE document, which John Mellinger talked about during the first presentation. And it's important to be familiar with those because as surgeons, I think we're up against some barriers in performing endoscopy, so it's important to become competent and proficient endoscopists rather than just saying, well, I can do endoscopy because I've done 50 colonoscopies. And then finally, a good score on gauges and a good clinical experience prepares people to become good, competent, proficient endoscopists in the future. Thank you.